Issues and Tissue, a contemporary magazine program that engages and discusses issues of development within and outside the state. The program brings to the fore ranging topics like education, politics, agriculture, just name it, while we examine the nitty-gritty of the issue in focus. Join me, BC Akpaida, every Wednesday on African Independent Television, AIT, for an exciting time. Issues and Tissue. If we can think it, we can discuss it. And this is African Independent Television, AIT, and it's good to have you once again on your program, Issues and Tissue, a developmental magazine program that addresses issues of development in Edo State and environs. And today we're here bringing you a very interesting topic. You know, it's actually our Independence Week. You know, tomorrow will be the 1st of October, and we will be celebrating Nigeria at 60. Well, someone says Nigeria is getting old. I'm sure we'll get to hear all of those today on the program. We will be looking at issues that affect the elderly persons in our society, and I have two very interesting personality with me on the program today. We'll be right back and we'll get to meet them after the break. Issues and Tissue, a contemporary magazine program that engages and discusses issues of development within and outside the state. The program brings to the fore ranging topics like education, politics, agriculture, just name it, while we examine the nitty-gritty of the issue in focus. Join me, BC Akpaida, every Wednesday on African Independent Television, AIT, for an exciting time. Issues and Tissue. If we can think it, we can discuss it. Okay, welcome back. This is Issues and Tissues, and you already know I am BC Akpaida. In here with me, we said we're going to be discussing, you know, issues that have to do with the elderly. And today I have with me Professor Obehi Akaria. You're welcome on the program.
Good evening. It's my pleasure to be here.
Of course, it's nice to have you, Professor. She is Professor of Medicine, School of Medicine, UNIBEN, and the Deputy Chairman, Medical Advisory Committee, team lead for geriatrics. But it's also good to have you. We also have Dr. Benson Kwara. He is the consultant physician, team lead UBTH COVID-19 response.
Thank you.
You're welcome.
It's my pleasure.
Okay, now let's go in quickly to the issues we have at hand. Yes, why are we here in the first place? Why are we here exactly? What are we narrowing in?
Right, so as we are all aware, there's been a pandemic, and this year the United Nations has crafted the theme, pandemics, do they affect how we address age and aging? This is the global theme for the celebration of this year's International Day of Older Persons, which incidentally is in its 30th anniversary this year. This year also happens to be the year in which Nigeria clocks 60. Technically speaking, the age cutoff for older persons set by the United Nations is 60 years. Okay. So if Nigeria were a person, we would be saying Nigeria has just joined the League of Older Persons. The University of Benin Teaching Hospital this year is celebrating Nigeria, celebrating older persons, and celebrating nurses, because incidentally, this year has been designated by the World Health Organization as the International Year of the Nurse and Midwife in commemoration of the 200th posthumous birthday anniversary of Florence Nightingale, who is considered the father and mother of nursing. Geriatrics has to do with the care of older persons. Nurses are integral in the hospital care of older persons. So we are weaving it all together and reaching out to the public to discuss issues that pertain to age and aging. That's why we're here.
Okay, thank you very much. Let me go to Dr. Okwara. You were actually into COVID-19 response, and can you say that the elderly persons have actually been treated fairly within this period?
To the best of my knowledge and from what we've seen happen also globally, yes, they have. But I'll be very quick to mention here that COVID-19, as Professor has said, is a pandemic, it's a global problem, and which cuts across all age groups. However, we also know that there are certain age groups that may be more vulnerable to this condition, and that is why we have to pay closer attention to this age group.
Okay, so what has been your observation so far?
Well, I'll speak from UBTH experience that we've had. If we consider the cutoff, which is 60, that age group, 60 and above, from the persons who have been infected in UBTH so far, they constitute about 35% of those who have been affected by COVID. And that represents over a third. But unfortunately, in that age group, we also have a good number of persons who have died. So because of that, we have to pay more closer attention to this age group to prevent this unfavorable outcome. And that is why everything we do, we have to pay very much close attention to this age group.
Okay, let me get to you, Professor Obehi. We'll want to narrow in on COVID and how it affects the elderly persons. Now, in defining the elderly person, you said 60 and above, right? Do we have medications, treatment for these people as it affects COVID? And have they been educated enough to know how to help themselves within this period so they don't catch the virus?
The issue is that older persons, from a medical perspective, are the ones who are more likely to have other diseases that increase the risk of bad outcomes from COVID-19. Hypertension and heart disease, kidney disease, liver disease, cancers, reduced immunity as a result of disease, as a result of malnutrition, or as a result of the treatment of disease. So, when we talk about medicines for COVID-19, we will, in the context of an older person, have to look at both COVID-19 and the comorbidities that this older person has. So, Okwara will talk about the specifics of treating COVID-19, but we talk about holistic care in geriatrics. So if someone has COVID-19 and has chronic obstructive airways disease and uncontrolled hypertension with hypertensive heart disease and chronic kidney failure and diabetes, which is just one example of the kinds of patients we have had to deal with. Some have even more morbidities. Then we should be thinking about medicines for COVID as well as medicines for hypertension and diabetes and heart disease and cancers. So it is this complexity that worsens the outcome for patients with COVID. So do we have the medicines? Yes, we have the medicines to a large extent. Do they have access to these medicines? That's a totally different question, because as we are aware, most persons in this country have to pay out of pocket for health care. So if the medicines are there on the shelf and they do not have access, that's another issue. Thankfully, though, the federal government of Nigeria had a policy during this pandemic that all persons with COVID-19 should be treated pro bono. So from the point of making the diagnosis of COVID-19 and getting transferred into an isolation center, they were able to have access to all their medicines. But that's for those who found their way to the hospitals. But we know that most people in our country, when they are ill, do not come to centers like UBTH or Stella Obansanjo Hospital. So many would have found themselves in chemists and private hospitals, and the story would have been entirely different.
Yeah, I think that's where the issue of education comes in. How much of education do you give, or whose responsibility is it anyway, to even ensure that the elderly person is actually educated properly on COVID-19 issues, bearing the fact that they bear more of the brunt?
I could just give some scenarios. When we have older persons who are diagnosed to have COVID-19, and the response when we have to break the news to the relative, the response we get is that, oh, my dad is 75, he doesn't actually go anywhere, and how could he have been infected?
Exactly.
And that is the scenario that plays out. And I tell them, look, yes, we know he doesn't go out, but you are the son, you're 35, you go out. And that is where the problem is. The younger ones who get infected may not have symptoms, or may have mild symptoms that look like malaria. But then again, they get to their homes and infect their older persons. And that's how the whole thing goes around. So the issue, Prof was talking about medication. Yes, when you consider the older persons, is a different ball game, well, entirely, because you're treating COVID-19, you're also treating other comorbid conditions. And the issue of drug-drug interaction, there are some medicines that don't go with some other medicines. So you have to balance everything together in such a way that it does not even cause further harm to this person. So publicity, media houses, print media, education from the health authorities, from the doctors, from the nurses, from everybody, including yourself. I mean, we can protect our older persons. I see this advert about I will tell your mama for you. It's about the older persons, protecting them because they are the vulnerable group in this pandemic.
Okay, in Edo State, how well have we fared in this area of taking care of the elderly persons with regards to COVID?
There have been so many things that have been put in place to ensure that this group of persons are given priority attention.
Okay.
I mean, when they come to the clinic and you see a whole different age groups there, attention is paid more to the older persons. Attend to them first so that you can go home. That plays out in UBTH. Let me go specifically to medical emergency. There was a policy that was put in place, particularly during this pandemic, that any person who comes in ill for whatever reason, even if the person does not have symptoms suggestive of COVID-19, you're tested. You're tested because it improves the prognosis if you get the diagnosis early and you institute some form of care, unlike waiting for the persons to develop symptoms. And those are some of the measures that have been put in place. They give them priority, they attend to them early. When I see a 65-year-old, 70-year-old who comes to medical emergency, and a 30-year-old who comes to medical emergency with similar symptoms, of course I'll pay more attention to the 60, 70 because that person is more like on a very thin line and you may have to address her concerns. The younger person may be able to push it through and survive because he's much younger, stronger, and has better immunity.
Okay, before we go on a short break, let me ask you, for how long do you think we will have to dwell or live with COVID-19? Because thinking about it sometimes, like something that has come to stay forever.
Well, I wouldn't say it has come to stay forever. We've had epidemics, we've had pandemics in the past. We had, if you recall, we had SARS, we had MERS, we had the flu in the 20s, 30s. We don't talk about them so much now, but they were pandemics. And I'm sure COVID-19 will be one of them. Right now, we are having a reduction in the positivity rate based on the persons that we have tested. Unlike June, July, when we had high positivity rate, is dropping. That is not to say it is uhuru and we will let our guards down. We will still continue to do what is expected to be done, and we hope that we don't have that predicted second wave that we are seeing in some European countries in Africa. Though WHO is saying Nigeria, Africa has escaped that maybe because of the humidity, maybe because of the climate, maybe because of, well, I don't know, but we are hoping that we don't have the second wave, and it will get to a point. You know, malaria, for instance, was once dreaded to the point that if you have malaria, you're more like going to die. So we are seeing a situation where COVID, with development of vaccines that's ongoing, I mean, you get a shot of the vaccine and you're protected. So it will become like yellow fever that used to kill, remember? So we are getting it down.
Okay, well, I think that's hope for us, because sometimes you just wonder. Well, we'll be speaking with Professor Obehi Akoria. She is a professor of medicine, University of Benin, and Dr. Benson Okwara. He is a consultant physician and lead team UBTH COVID-19 and response. We'll be right back after the short break. Issues and Tissue, a contemporary magazine program that engages and discusses issues of development within and outside the state. The program brings to the fore ranging topics like education, politics, agriculture, just name it, while we examine the nitty-gritty of the issue in focus. Join me, BC Akpaida, every Wednesday on African Independent Television, AIT, for an exciting time. Issues and Tissue. If we can think it, we can discuss it. All right, you're welcome back. You're still on the program Issues and Tissues, and I still have my guest here with me, Professor Obehi. Let me ask you this question. How can we care for these older persons? Because he's mentioned something, and it just occurred to me that that's true.
If you ask me, I think that one of the biggest challenges we had with COVID-19 was that people did not believe.
Okay.
That was a big challenge, and we can't talk about helping to protect somebody from what you don't even believe exists. So question is, why didn't they believe? So there is a basic lack of trust in the populace, or maybe we should come to the media and say, how did the media handle this? How did our churches, our mosques handle this? This is a real huge issue, because going forward, it may not be COVID-19 tomorrow, it may be something else. If I say, for example, wash your hands frequently with running water and soap, that causes me absolutely no harm and does me and others around me a lot of good. For one thing, the incidence of diarrhea and vomiting will reduce simply by washing my hands. And there are a lot of other infections that will reduce. But you find that it didn't happen. Put on your face mask. It was a struggle. Ensure physical distancing. It was a struggle. The major thing was, it's all about me. So how can we help the elderly? It cannot be all about you, because what goes round comes round. You go out to town, like Ben said, you pick it up. The older person is probably at home. Some of them are even more physically active than some young people. But we pass it on. They get it and they pass it on to both young and old. So I think that to prevent this going forward and to protect ourselves, we must realize that we are all intricately linked to one another. Nobody is an island, and there is no way you can be certain that you will not pick up something. You heard Ben. 35% of the persons who caught COVID-19 were people aged 60 years and above, meaning that 65% were in younger age groups. Unfortunately, this 35% makes up just 5 to 6% of the population and accounted for almost 70% of the deaths. So how to protect? I am linked with you, you are linked with me, we are linked with one another. Let's watch out for one another. Believe that what is out there from credible bodies like the World Health Organization, the NCDC is out there for our protection. Believe and act on what is being put out there. Because knowing is one thing, doing is another thing. So it's not all about me, it's all about us. And we should be working hand in hand, protecting each other. Some things may not be convenient for me, but because I know that older persons are more vulnerable, are more likely to die from COVID-19, I will do this at my inconvenience for the sake of me and for the sake of that other person.
Okay, looking at the NCDC post, with regards to the numbers of persons affected by this virus, it seems to be reducing, and some people are already throwing off their face masks and say it's like, my body is now used to it, so nothing can happen. Are you saying it's time to relax, or what would your advice be?
Interestingly, I think before the figures been thrown out there by NCDC, people had actually, in the words I would like to choose, relaxed. Even before we started having reduced numbers. I could speak to Benin City, for instance, where it was quite difficult. It looked as if it was in the hospitals that people were actually wearing a face mask and observing physical distancing. I mean, the moment you step out of the hospital setting, it's a different scenario.
So like a gate pass, actually.
Absolutely. So it was difficult, but thankfully I would say, despite all of this non-adherence to simple guidelines, we are beginning to have a reduction in the numbers. That is the truth. We are seeing that. There may be a lot of arguments about we are not testing as much as we tested previously.
Okay.
But then again, we are still testing. We are still testing in UBTH. We are still testing those who come in with various symptoms. And we are seeing a downward trend. So when people make that argument, I say, well, that's maybe true in one aspect, but we are still testing those who have suggestive symptoms. The people who have tested in this month of September, who have cough, fever, or difficulty with breathing, you test maybe 20 persons, you may just get 1 or 2. In June, July, you test 20 persons, you get as much as 5 to 6 to 7 who are positive. So yes, we are getting those. But then again, we cannot say we should just fold our hands and relax. There are still a couple of infections out there. We are still picking positive cases. And those ones may be sources for transmission. That is the truth. Particularly for persons who may not have been infected before now. So we still need to maintain hand washing. We still need to maintain physical distancing. We still need to do all the things that we need to do to protect others and ourselves. Because you must think about others. When you think about yourself alone, then that will be a little bit selfish. You must think about others, then yourself. Others, yourself. Protect your parents. Protect your loved ones, then yourself. It's very important. So we need to continue to maintain these things so that we don't begin to have increasing numbers from the reducing numbers we're having right now.
All right, I'm sure we all will want to celebrate with our older persons, especially this period. It's their time, so let's celebrate them. In celebrating them, what are we supposed to do? School is resuming, and I'm sure quite a number of them might be, might be afraid of the fact that, okay, now that school is resuming, just maybe my child will bring in this particular virus.
Schools are resuming, and children will go to school. Children will be children. The government has put in place guidelines for schools that must be adhered to as schools open. But if we are to be real, the violations will be there. And the onus will be on us as parents to convince our children to adhere to these guidelines. The onus will be on us as teachers to believe that we need to model what we expect our children to do when they are in school and out of school. The onus will be on the government to ensure that there is monitoring and sanctions for those who do not adhere. And then back on the home front, the onus will be on us as families to stay protected. The children come back from school, running water and soap to wash our hands, and cough hygiene, sneeze hygiene. It's not the time to let down all our guards and cough and sneeze into the air. We need to teach ourselves to cough into the elbow, sneeze into the elbow, and so on. And all those good things we have been talking about all this while about COVID, we need to take them seriously. Because the truth is, if things get out of hand, it's not going to look good, especially for the most vulnerable. So starting school is a test case, and we all need to be on our guard and put in our very, very best to ensure that the guidelines are adhered to. Then regarding the older persons, they need to have the sense that we have them on the front burner. Their anxieties need to be allayed. And I believe that as they see us talk and walk the talk, they will feel more confident to do what we asked them to do. And I think that everybody will be better for it.
Okay, on Thursday, which is October 1st, will be a day to care for the older persons. I know you have quite a number of activities lined up. Do we want to talk about it, or you want Prof to talk about the activities?
I think Prof will be in a position to talk about this.
Right, so
especially that one for the 1st of October.
So you just fell into my trap.
Okay, all right.
So you fell into the trap in the sense that you say October 1st is the day we will care for the elderly. No. Okay. October 1st is the day we remember that we have a duty to care for the elderly.
Okay,
it's a day to pinch ourselves, remind ourselves who they are, what they have done for us as individuals, for us as societies, for us as a country, and why they deserve to be honored. It's a day for families and governments to think about doing things differently to honor aging. For goodness sake, every birthday you celebrate is a reminder that you are aging, whether you like it or not. So for those who have gotten to 60 and above, we are telling them we value you. You are our heroes. Your labors shall never be in vain. Our mothers took care of us. Our grandmothers did. If you ask me, October 1st in Nigeria should be like Christmas Day for the elderly. If you can take them out, take them out. If you can buy new clothes, buy new clothes. If you can have family meetings and think about how to make them enjoy life. Whatever you plan to do after they are gone is for you. See how much we spend for burial ceremonies. Can we please spend this money on them while they are alive? Make them. I was just thinking a few days ago, I saw a big billboard about somebody who had died. I said, goodness, how will my mom feel if she wakes up in the morning and see that kind of billboard about her birthday? I think it's better done for her while she's alive than when she's gone.
Absolutely.
So, for UBTH management, what we have always done since 2018 is target a group, celebrate them. 2018, we celebrated all our retirees. 2019, we took it out to towns, screened and treated elder people from 7 local government areas. The meeting point was Ego local government car park. The chairman worked with us. This year, because of COVID restrictions, we are focusing on retired nurses in their capacity as elders, and we are going to have a bang with them on the 1st.
Well, I'm sure I would love to be part of that, so that let me even begin to experience and enjoy what older persons feel. At least maybe an interaction with them. It's nice talking to you, Professor Obehi Korea, and Dr. Benson Opara. Thank you so much for coming on the program. Well, that will be the much we can take on the program today. I will be speaking with the Professor of Medicine, School of Medicine, that's UNIBEN, Deputy Chairman, Medical Advisory Committee, UBTH. Thank you so much, Madam, for coming.
Thank you, Benson.
And the consultant physician, that's team lead UBTH COVID-19 response, Dr. Benson Opara. Thank you so much for coming.
Thank you. It's my pleasure.
Well, of course, let's begin to celebrate the elderly persons within us and amongst us, of course. Like our guest said today, it's better you celebrate them while they are alive than when they are gone. I'm sure they will appreciate some of those good things and those parties we throw after they are gone. While they are alive, they would appreciate it. And yeah, keep a date with us again next week, same station, same time. I'm BC Akwaida. Have a lovely day. Issues and Tissue, a contemporary magazine program that engages and discusses issues of development within and outside the state. The program brings to the fore ranging topics like education, politics, agriculture, just name it, while we examine the nitty-gritty of the issue in focus. Join me, BC Akwaida, every Wednesday on African Independent Television, AIT, for an exciting time. Issues and Tissue. If we can think it, we can discuss it.